Assalamualaikum everyone and good afternoon. Welcome to MyMOMS webinar entitled Empowering Mothers Through Shared Antenatal Care. I'm Associate Professor Dr. Amelia Dato Zainuddin from the Department of Obstetrics and Gynecology, HCTM UKM. I welcome you to this webinar. The purpose of this webinar is to introduce you all to the mobile apps MyMOMS, which is a tool to empower moms and healthcare workers alike in communicating towards a better shared care. In view of the current pandemic, where it is difficult and dangerous for patients, especially pregnant ones, to come to the hospitals or clinics to attend the antenatal appointments, the creation and implementation of this tool is indeed a timely one, as it can be used as a form of communication between pregnant moms and their healthcare workers, and it also is a potential tool for telehealth consultations as well. First, before we start listening to the talks by our two esteemed professors, we will proceed with a video on MyMOMS.
Hi, I'm Dr. Nadia. As an ONG specialist, I want the best experience for my patients. Monitoring their pregnancy growth is very important. Introducing MyMOMS, a digital pink book for expecting mothers. With MyMOMS, it is easy for me to monitor and personalize the growth charts of my patients. Here's how it works. When you have a new patient, get them to create a profile on MyMOMS. And then you can key in the details of their medical screening. Most patients have many questions in the first trimester, especially first-time mothers. With the Q&A function, your patients can ask questions and get answers from yourself or your colleagues anytime, anywhere. The first ultrasound is the most exciting moment for mothers. Once the scanning is done, you can upload the image into the app and you can access it for the next review session. Another exciting feature on MyMOMS is recording the kick counts. Patients can easily click on a button every time there is a kick, and the kick counts can be monitored by the ONG specialist. All personalized records are stored on cloud. Hello! So when preparing for a delivery, you can easily access your patient's records for a final review. MyMOMS creates a pleasant experience for you and your patients. It also makes it easy for team collaboration. MyMOMS, baby steps on your palm.
Thank you for that. We will show a repeat of that video at the end of the webinar. One of the audience was asking in the question and answer whether we will provide certificates of attendance. We can do so. At the end of this webinar, we will be showing you how to download a survey feedback form. And then if you put in your correct details in the survey, we will gladly email to you a certificate of attendance. Now it is my great honor to introduce my colleague, Professor Zaleha Abdullah Mahdy, who will give the first talk entitled MyMOMS, Empowering Mothers Through Shared Antenatal Care. Professor Zaleha Abdullah Mahdy is my senior professor. She has been my colleague and my mentor for over 20 years. She is a professor and senior consultant obstetrician and gynecologist at UKM Medical Center and is the lead researcher and the one who came up with with this MyMOMS idea of MyMOMS project. She is very techno savvy and is doing a lot of projects now involving virtual simulation, etc., and drones, doing a lot of things which will be very useful in the pandemic and in the future, in the near future, inshallah. It is with great pleasure I present to you Professor Zaleha Abdullah Mahdy.
Thank you very much, Amelia, for the kind introduction. Bismillahirrahmanirrahim. Hello, everybody. I will share my screen so that you can see my slides. Okay, right. Now, MyMOMS. This is our digital pink book. The pink book that you have, we have modified that to some extent to fit it into this MyMOMS application. And I shall present to you the details of what we have in MyMOMS so far. Right. We all know the challenges of record keeping in antenatal care. These are part of the so-called like wish list that we want to have in any antenatal care records that we keep for our patients. One, we want to have medical alerts. For example, a list of allergies that the patient has, their problem list, their medication list, so that we can refer to it at a click of a button. And investigation results, for example. Sometimes we find not only difficulty in tracing, but also sometimes people might forget to trace certain investigations because there's a gap between one visit to the next. And this can have quite profound implications in the sense that, for example, you don't trace a UTI result, your patient may get a preterm labor and all that because of untreated UTI. Group B streptococcus infection, for example, it's a notorious investigation that sometimes get untraced until it is overlooked, and it can end up with a neonatal sepsis because of that. And things like precautions in management of your patient. For example, you may want to highlight that your patient has got a valvular heart disease that requires prophylactic antibiotics around the peripartum period. Same thing with GBS infection, you would want to cover them with peripartum antibiotics and so on. Communication among healthcare units that take care of the patient. This is where MyMOMS can play a big role in terms of shared antenatal care. In the monitoring of patients with hypertension, for example, or diabetes mellitus, their blood sugar levels and all that, the continuity of care is so important. Through MyMOMS, you can actually see the whole complete set of notes that everybody puts in order to monitor the patient. And with the physical pink book, there are certain limitations. For example, if the book is misplaced, you get floods and the book gets washed away, and storage of hard copy files in the Klinik Kesihatan, which comes at a cost and is not very environmentally friendly. It needs a lot of space, and the impact of discarding prints in the future, that sort of thing. And also the records, whatever we put into our physical pink book, it doesn't get analyzed. The data doesn't even get into any database, so to speak. So with the digital pink book, all this can be overcome. And you can actually, have an antenatal surveillance at a macro level, almost in real time. And now, these are common factors that cause issues in pregnancy monitoring. For example, physical limitation with the print buku pink, in its current form. It has little flexibility in the organization of information and access for collaboration amongst clinics, labs, and patients. Very often, it's when you see a patient, the book is so thick, you don't know where the last entry is, and you spend so much time flicking through the book, where is the last entry? And the physical pink book does not empower mothers to participate in the pregnancy progress. Both mothers as well as the healthcare workers find it difficult going through the pink book and contributing information effectively. We do not know whether, whatever we entered previously can easily be accessed by the next person, because the book gets swarmed with so much writing in no time. And often you get, a situation where there's a lot of papers being pasted on top of it, and you don't know where it ends, where it begins and where it ends. So the key values that we consider when reimagining the Buku Pink in the digital form, first is safety and privacy. validation of clinical information by the patient, because the patient has got access to whatever is entered digitally as well in her smartphone. So she's well informed about what is going on. And there is consistency in shared data across multiple settings. And it is personalized, specific to the patient, and it is legible information that the patient wants to see and others want to see as well in other clinics who also similarly share the antenatal care of that patient, like Klinik Kesihatan or a GP clinic and so on. Because we know very well how difficult it is to read a doctor's writing. And at the professional level, this is an effective, efficient, economic, and empathetic way to share data among healthcare workers about a patient. And there is a release time to care and a direct connection with the patient, because she can see whatever is in the records. And it's family friendly. It is accessible and portable. You are able to understand, the patient is able to understand her maternity journey at a time when it suits her. This is our journey towards digitalizing the Buku Pink. It started off at about the onset of the first MCO. This is when, we worked with the IT experts in order to establish the research, to get it going, and also to work on the digitalization process. This is when we set up the team and we collaborated with our technological partner. And in February 2021, the development is more or less complete, and it incorporates all the features that we want for it to bring value to the shared antenatal care. And in June 2021, we completed the alpha proof of concept testing within PPUKM to test its applicability. And in July 2021, we are ready for the beta trial with other hospitals for further research and refinement of the our digitalized pink book or MyMOMS. These are some of the features in MyMOMS. We have a pregnancy dashboard. We have risk color coding for the sake of being in tandem with our Klinik Kesihatan. We have a problem list on the front page of the patient. Investigations to trace is also there. Laboratory test results are there. And we have specific pages for diabetes and preeclampsia monitoring if the patient has these problems, because it's so common. And with regard to the clinical history, we cover obstetric history, gynae history, medical and surgical history, family history, social history, immunization, and allergies. There is a clinical examination at booking visit recorded there. Antenatal records at every visit is there. Routine screening is in place. So is systemic examination, and serial clinic visits findings are incorporated in the book, as well as ultrasound records. And soon the patient will be able to put in their daily pregnancy journal if they want to, that is at their interface, and shared with the patient is fetal kick count. And as patient puts in their fetal kick count, we can actually see from our side, the fetal movement chart. And questions and answers can also be fielded by the patient for us to answer. And administratively, new admissions are there on the front page for Carian Pesakit, or when you search for your patient, and a list of admissions, new appointment, viewing appointment, and looking at who did not turn up for your appointment when, appointment alerts for the patient, as well as daily did not attend alerts. This is the patients who skip their antenatal visits. You'll be able to see at your patient search page. And postnatally, birth record is kept in the digital pink book, as well as baby record, mother's postnatal monitoring, postnatal risk assessment, and mother's postnatal visits. If there is one by the clinic kesihatan, that can be recorded there as well. And also records of neonatal jaundice, including serum bilirubin level from day to day. A graph will be, formed from the data that is entered. So if I could just give you a sneak peek into the MyMOMS records, a quick walkthrough. Okay, this is the patient search page. You can see at a glance how many new pregnancies have been registered, and how many patients did not attend your antenatal clinic. Here is the carian pesakit or patient search, and you can search according to category, whether it is according to the patient's ID or according to the patient's email address or according to the patient's name. Okay. And this is the front page of the patient profile. For example, Amanda Roslan, this is a tester patient. It's not a real patient. We put here. This is the due date, the gravida impara, and this is the color coding of the patient. You can ask the patient to snap a picture on her handphone and put the picture here, so that, at a glance you can know. Sometimes we may recognize patients by their face, although we may not be able to remember everybody's name. So this gives you a chance to actually, be able to track your patient's records and see their picture at the same time, so that this is the patient whom I saw, say 1 week ago or 2 days ago or whatever. Okay. And this is all the patient's records. Their husband's records will be there as well, nama pasangan and all that. Okay, this is the fetal kick chart. Okay, if you click here, you can see the fetal kick chart that the patient has entered. Okay, and down here is the next appointment. Okay, and this is the list of problems that you can highlight here of your patient. If the patient is GDM on insulin, for example, you can put here. If the patient has got SLE, for example, you can also enter here. You can enter as many problems here as you wish. And if you click here, you will get the details of the problem that you have entered. For example, if the patient is on SLE, you can enter here what are the list of drugs that the patient is on, so that you don't have to keep, flicking through your notes in order to be to see what is the latest drugs that the patient is on. Okay, and this is the list of lab results that you wish to that you have taken and you wish to trace, for example. Okay. So you can put it here so that at the next visit, you don't forget to trace the patient's results. Okay, so so this is the list of problems. This is the list of investigations. For the next appointment, this is how it looks like. Okay, so you can actually, if you click here, you can actually update what are the things that you want to look for in the next visit. For example, you can put a note in this temu janji seterusnya, and the patient actually gets an alert 3 days before the appointment date, so that she is reminded of her appointment date and can make the necessary arrangements to come. And down here is the senarai semak for the color coding. So when you enter here, some risk factors for the patient, automatically the color coding will appear as I've shown you just now. Okay. And this is the pages that you can go through. Okay, for example, perihal kandungan lalu, this is past obstetric history. Okay, you can enter everything here. And ujian saringan antenatal is your VDRL, hepatitis B, HIV, and all that will be here. The patient will also be requested to consent for the HIV and the whole list of antenatal tests that she has got to take, just like in the real clinic kesihatan, where you're supposed to actually take the patient's consent for, say, HIV testing. Okay, this is the past medical history, This is the present pregnancy, and this is the consent for the antenatal testing, as I mentioned just now. Okay, so that that is well covered there, medico-legally. And if the patient has got preeclampsia, you can click on this page to enter her details. This is MGTT and blood sugar profile and home blood glucose monitoring if that is relevant to your patient. Okay, and this is all the list of ultrasound that has been done for the patient. This is the pemeriksaan kandungan semasa, that means the antenatal visit that you are going to do for her today. You enter here. Okay, if she's supposed to be admitted to hospital, or the hospital, the summary of the hospital admission can be entered here. And this is the birth record of the baby. Okay, so a sneak into what the booking visit would look like. This is how it would look like. If you wish to enter the booking visit that she had in an earlier clinic, okay, you can also do that so that you don't lose any information. For example, the booking weight and all that. Yeah. Okay, and this is the what you have entered for each of the visits that she has come for. And this is the blood pressure monitoring, for example. Okay, it will come out here, the hemoglobin. If there's more than one results, then a graph will be formed. And this is the symphysiofundal height graph. Okay, so that you can see. In the long term, we are going to incorporate the personalized growth chart with this. Prof. Rosnah will be talking about this. So that will replace this simple symphysiofundal height graph. So that will be your fetal growth chart. And okay, this is how the BSP records will look like. Okay, and this is the whole blood glucose monitoring, which the patient herself can enter actually. This part the patient can enter, or you can enter if she's forgotten to enter and she tells you the results at your next clinic session. Okay, so both sides can enter. And this is how the fetal kick chart look like. And all the specific information or instruction for the patient is also there. Right, this is postnatally, if the baby has got neonatal jaundice, and the levels of the serum bilirubin can be entered by, say, the nurse, for example, and it will appear here. Okay, so our future plans in order to keep improving the digital pink book that we have is to incorporate a customized fetal growth chart, which is already in progress. We already have the customized growth chart. Prof. Rosnah is going to talk about it. She leads the project. Okay, so this is specific for the Malaysian population according to ethnic group, height, weight of the mother, and so on. Okay, and we also intend to put in easy access to scheduled teleconsultations, as well as some public health education for the information for the mother. And we would like to know what you think about the digital pink book that we have developed. Your feedback is very much appreciated. And if you would like to participate to trial MyMOMS in your hospital or clinic, do let me know. You can take down my email address as displayed here and send an email to me. Thank you very much.
Thank you very much, Prof. Zaleha, for that excellent talk. So in summary, Prof. Zaleha presented to us the challenges in antenatal care and what were the physical limitations of the pink book, and that mothers cannot be empowered in their own antenatal care. So with this MyMOMS project, with hopefully with the guiding principles incorporated, and now it's in the beta testing phase, inshallah, we will be overcoming all these challenges and empowering the mothers to take care in their own antenatal care. Thank you very much, Prof. Zaleha, for showing the features of MyMOMS. And what excited me the most is to see how easy it is to read, how user-friendly it is. And we don't have to crack our heads trying to read other people's handwriting anymore. I just want to inform the audience, do put in your questions at the question and answer box. After the second lecture by Professor Rosnah Sutan, we will have a panel discussion and a question and answer session as well. And we will be reading out your questions to be answered by the panelists. Now it is my great pleasure to present to you the second speaker, Professor Rosnah Sutan, who is my colleague and friend. She's a public health medicine consultant, community health from the department of community health in HCTM UKM. And I know she's a very passionate advocate of women's health and previously was very active in promoting sexual and reproductive health of our young women especially. Yeah? And she actively finds ways through research to improve patient empowerment for better quality of care. So she will present today her talk titled Localized Growth Chart, a collaborative study of UKMMC and Prenatal Institute. I welcome Prof. Rosnah Sutan.
Okay, thank you, Prof. Amelia, for a nice introduction. Okay, so today I will be presenting as a second speaker for the webinar on MyMOMS. As we can remember, the last message by Prof. Zaleha just now say that they're already ready with the platform on the MyMOMS. So what next future? Yeah, the future plan. So based on the whatever that if we want to incorporate into the existing platform, digital platform, it must be evidence-based, proof evidence-based. So now I will present it on Grow My Personalized Fetal Growth. Yeah. So, okay. Okay. So the personalized growth chart actually is based on the research that we just recently completed under GUP 2017-115, and this is a research committee which is involved the obstetrician, the pediatrician, and also the public health. So we are looking for what are the best evidence or innovative available internationally, as we couldn't find in locally, because we know that in locally we only have one population growth chart that we incorporate into the pink book. So we think that other country already advanced with come up with the customized, we also want to follow. So we get to know this Prenatal Institute, they already come up with a grow application. So, and we see that their aim, their goal are matched with us is to improve quality of care for mothers and baby. So with in HCTM, we have this database which is owned by the Department of ONG, and the database is being collected in the based at the delivery from 2010 until now, and it's being managed by the Central Madi link. The data is already almost 50K delivery data in HCTM, and we go through the database and we found that we can simply get some of the singleton with non-pathological and come up with predictors to be created to be incorporated into the Grow My as what that Perinatal Institute do. So through the shared knowledge, we come up with and we completed this study. So next. Okay. Okay. So we go through the literature and we see that what are the challenges that we are facing with perinatal care. From the database, we know that we can see that the low birth weight and the stillbirth, it seems that it already in the plateau. So it does not improve, even though we know that Malaysia are improving into the socio-economic status, and we already been known by the WHO. We are have better infrastructure and better quality of care for the maternal and child health, but we did not see any improve in terms of perinatal care related to these two data, which is the low birth weight and the stillbirth. And furthermore, SGA is not routinely collected as a national indicator, but from the ad hoc study, which is done locally in a small scale study, we noticed that the SGA parameter also is not improving. It's almost between 10 to 15%. So we go through into the what that we can do next. Yeah. So we know that nowadays people are more educated and mothers are more excited to be part and to be involved in shared care. So we see that what the patient involvement that we can link with the existing care. Yeah. So through the platform digital that we have now, which is the My Pink Book, or we call it My Mom in the digital way. So we want to incorporate, if possible, yeah, how the mother and empowerment can improve in terms of fetal growth monitoring. So the idea is only fetal growth monitoring for this current presentation. So we know that we have these cases being monitored and everybody are following the perinatal care manual. And if we go to the perinatal care manual, definitely it's written there, the fundal height or the fetal growth is being monitored by the symphysis fundal height measurement. Yeah, and also the fetal height being monitored through many ways, it's ultrasounds or into the fetal height scope and all that. So the next thing is about the antenatal monitoring. If we see the data that we have in Malaysian healthcare, mother come to the antenatal checkup as early as first trimester, which is less than 20 weeks. And they regularly follow up in the antenatal clinic. It's either in hospital, private hospital, or in the private clinic or in GP, regularly until delivery. So why don't we incorporate the patient empowerment in here? So the idea is if we want to follow, improve into our perinatal care through the fetal antenatal care, fetal monitoring, is because of if we can reduce the fetal growth restriction, basically we can reduce the stillbirth and we can reduce the neonatal death. And on top of that, we can reduce the number of perinatal morbidity. As we know that if we can reduce the perinatal morbidity, indirectly we can able to reduce the adverse effect in later life. Yeah. So next is okay. So this is available in website MOH, yeah, KKM. They have this perinatal care manual. They have this guideline, and they have this pink book, as mentioned by Prof. Zaleha just now, the buku pink, pink book. Yeah. So it's in a manual. So everybody need to go to the pink book and then open up, and then they fill up all this antenatal care monitoring. Yeah. So one is the most important thing that related to fetal growth, which is the berat ibu or the maternal weight. Yeah. So we know that increased maternal weight is should be highlighted as a risk. Yeah. So they need to have a proper referral to the specialist. Yeah. So we know that in normal it should be 0.5 or range from 0.5 to 0.75 kg per week. Should be more than 20 weeks, yeah, not less than 20 weeks. We cannot use this range. And on top of that, we also need to measure the symphysis fundal height. It's written here, tinggi rahim in centimeter. Yeah. So how do they do it? I will show it later. Yeah. So the most important features that is available in perinatal care manual is if there is discrepancy between SFH, symphysis fundal height, and the period of amenorrhea is either plus or minus 3 centimeter, they need to be referred for the ultrasound scanning and seen by the expert. The problem is, how do they know, yeah, whether this is discrepancy or not discrepancy? Yeah, the mother need to know where is the POA. So it's not that user friendly for the mother to monitor themselves. So most of the mother think that this pink book is not for them. This pink book is only for the clinician. So sad to say, the mother carry the book all the way for 9 months, but is only being used by the clinician. That's what the mother thought. Yeah. So we need to improve this one. So next I will go to, yeah. So from the evidence base, this is the recent national-wide study done by the KKM in 2019, in 2016. And we see that some parameter or the physiological maternal characteristic, there is a difference between the ethnic group, difference between the parity, difference between the maternal age group, and between the BMI. So from that one, we also go through in terms of looking for other systematic review, whether is it true that if we use this parameter, we can improve in terms of the identifying through a customized growth chart. So in UKM also, we assess those who are diagnosed as SGA, and we plot out that we found that the birth weight are always at the lower side. Yeah. So we want to know whether they are at lower side, can we pick up them early? So so we come up with the protocol of the study, and it's already been published. If for those who want to read it further, but not for this presentation, I will not go through in detail. So we come up with this term optimal weight. Yeah. So we come up with whatever that been developed by the Perinatal Institute, but we use our own data, our HCTM data. So we come up with this parameter, we see that, oh, we need to come up with a proper growth chart, yeah, using our data. Yeah, the reason we already go through the systematic review, and we found that the parameters are similar as what that we found in our data. And we have this system that we also can check who are being diagnosed as SGA, because in that database, there is also ultrasound data that we can link and check whether is it true as what that been written as diagnosed as SGA, and is the ultrasound information also say so. Yeah, and from the when we come up with the Grow My chart, we help from the Perinatal Institute to come up with Grow My apps. We tested retrospectively. We select the 500 cases, and we select those are SGA and those are not SGA, and we plot that into the graph. And we found that the graph is feasible, and the graph is appropriate to be monitored. So we go through another prospectively, we select another 500 cases, and we follow through this mother until the delivery. And then we see that the graph is available, is readily to be monitored by the clinician as well as the mother, because the chart we print and we put in the patient record. Okay, so as you know that SGA, it should be managed carefully by the clinician. Yeah, so in HUKM, we come up with this algorithm with advice from Perinatal Institute and also from the clinician in the HUKM. But for the study that we are using now, we only want to test in terms of the growth chart. So once we diagnose as SGA, the case is definitely should be monitored as what the guideline outlined in the HUKM. We did not change any guideline once they be diagnosed. Yeah, we only come up with the early screening chart. So we select, we train our clinician registrar. So one of our ONG specialists train all the registrar to make it standardized. Only one trainer who train all the registrar on the use of Grow My chart and how should be measured the standardized SFH. And from there, we also highlight who are the risk cases that we need to refer and should we follow the SGA guideline as what it is. Yeah. So the cases of recruitment that we select is according to what been advised by the Perinatal Institute. It should be more than 24 weeks, and we select only the Malaysian, and we select the normal as well as singleton. We did not take in those are multiple pregnancy or those who are having maternal problem, because they always be handled separately into a certain specific guideline. So based on this recruitment, we generate the Grow My chart. Yeah, from the Grow My chart, we put into the patient PhD and as well as the pink book for the mother to see and empower them. Yeah, so they can charting the symptoms from the heart. Yeah, so as you know that this study is being conducted in HCTM, and most of the cases been seen not only by clinician, they also been assessed by ultrasound. We also plot in the Grow My chart. Okay, this is the screen, yeah, how that we see the Grow My apps that been developed by the Parental Institute for us using our local data. Yeah, so this is the parameter, the maternal physiological characteristic that we use to come up with the Grow chart. So we use the ethnic group. Yeah, so the ethnic group we come out as what that I showed you earlier, based on the parameter, the Malay, Chinese, Indian, and also other ethnic group which are commonly seen in our data, and maternal height, maternal weight, parity, and also maternal age. And we come up with the chart, yeah, as shown in the this TikTok. Yeah, just let times go on until we see the chart, so that everybody we can see how useful it is. Yeah, and it is so simple. Yeah. Okay, so okay, so from here, what is the next? Patient empowerment. So we want to know what patient can be enrolled in terms of shared care, as what been proposed by my mom, that we want to promote shared care. So during pandemic COVID, yeah, this is an advantage if we want to sell this idea. Yeah, mother actually can measure their fundal height, because actually is when any pregnant mothers before they sleep, they always put their hand on the tummy and they try to feel where is the baby head and where it I mean the baby is normally lying. Yeah, so they know how the baby lying, whether on the left side, on the right side. So if we can empower them just a little bit knowledge using this tape measure and put their hand on the fundal, yeah, the top of the fundal height, yeah, and then put up the measure tape over their fundal, their tummy, and then measure the symphysis, which is the bone area at the end of the fundal, the end of the tummy, and that is the symphysis fundal height, the symphysis pubis. So and then they just get what are the measurement and then put it on the chart. Yeah, so it's so simple. Yeah, people, mother can be empowered and they can do it. Yeah. Next. So this is the chart. Yeah. So when the mother have the chart, yeah, we are put in the parameter. The cross one is the symphysis fundal height, and the circle one is the based on ultrasounds measurement. Yeah. As you see that in this is in HKM, so almost all visit have this ultrasound measurement, but we are interested in the fundal height and this chart. Yeah. So definition of SGA should be less than 10 centile. The 10 centile is this lower end. Yeah. So if you see that the mother can see, oh, the baby is, the fundal height is above this 10 centile, they are very happy. And of course, if there is correlates with the ultrasound finding, which is above that one. Yeah. Even though it's higher, because sometimes mother feel is higher up. Yeah. Especially this is overweight mother and this is an obese mother. Yeah. So, but surprising, we see that we are correlate. Yeah. Both ultrasounds and fundal height, they see there is above the 10 centile. They are not belong to the SGA cases. So this is another one. Yeah. If you see that the symphysis fundal height, and this is ultrasound, the ultrasound always pick up lower. Yeah? And at the delivery, the mother, this is at the delivery, yeah? Birth weight is 3.3, gestation at 38, and we plot is almost similar as what the fundal height measurement. Yeah, and same thing with this one. Yeah, even though the ultrasound shows like this one, yeah, but later we found that the fundal height measurement is almost similar, and then when we plot in at the delivery, and this is the thing that we get, yeah, same thing with the previous one. Yeah, this is the previous one. This is the ultrasound measurement, and this is the fundal height measurement, this is fundal height, and this is the actual birth weight, which is 3 kilo at 37, and it was almost correlate, yeah. So we are happy with that, and this is the same thing, yeah. So this is the actual birth weight, which is 3.6 kilo at 38 weeks, and we are happy. We are not miss anything, yeah. So okay. So when to refer, yeah? And basically we can just empower the mother. If you found that it crossed the line, yeah, you need to alert, yeah, you need to be alert that it could be that the tendency of the baby is not growing well, yeah. So we can empower the mother so that mother can be cautious enough so they can be monitor the fertility clearly, regularly, and like this is, yeah, because we empowered the mother, the baby is still alive, you know. So even though the baby is 2.4, is low birth weight, but actually they are normal. They are not SGA. It's not below than the 10 centile. Yeah, so it's a normal baby. Yeah. So so if you see that this is among normal baby, yeah, we cross check with Fenton assessment, and they are normal baby, yeah. Even though we see that chart cases diagnosed SGA by hospital, yeah, in the hospital, because we have this Op Central Medic Link database, we go through the diagnosis, they put as SGA because they have this measurement, ultrasound measurement. But when we plot into the GrowMy chart, they are normal, yeah. So when we follow, yeah, even though they cross the line, they are still not SGA cases. And when they delivered, we found that they are not SGA and being discharged by pediatrician because they are not SGA through the Fenton assessment. So so this is another one. So this is the actual birth weight, and so this is the actual birth weight, and this is the actual birth weight. Even though being diagnosed as SGA in the Op Central Medic database, yeah. So we always need to double check because just growth chart alone is not enough. We always need to double check with the clinical features so the clinician know better. Yeah. So next, what is the other function that GrowMy that I want to share? Because normally, me as a public health, we always craving with the data. Yeah. So we want to know at the end how many we can save. Yeah. How many that we refer and how many been detected. Yeah. So because this is by done in HCTM, all cases been done with double check with the ultrasound. So it almost similar. So later, let's say that if the chart been used by the clinic with no ultrasound, so we can see that how many can we refer and how many actually been diagnosed. Yeah. So this is the measurement actually that we follow in terms of come up with that one. So what next actually? We come up with the evidence, we completed the cases, we completed the research, and we found that this is something that add on value that we can be incorporate into the MyMOMS because it's just a simple, just put in the growth chart and we empower the mother, and the mother can measure the feces for the height, and we empower the mother how important is the fetal kit chart and how important is fundal height, and they can check their monitoring with the clinician when they have a routine visits. Yeah. So later on, if we have a teleconsultation because we don't know when is this COVID will be improved. Yeah. So we need to think ahead. If we have teleconsultation through virtual clinic, we need to ask the mother to measure their fundal height. Yeah. So it's something that we give them something for them to plot on. Yeah. So it's much easier. If we see that in KKM, yeah, I get this data. If we can utilize the primary care, because primary care is known that the earlier the first contact the mother go. So if we can empower the mother who access this primary care, if the primary care have this software incorporate into the system, because they also moving towards the typical objectives of telehealth. So if we have this software incorporate like what that we intend to do for the MyMOMS, or maybe in future in the government or private clinic or private hospital, they want to have this MyMOM in the hospital, we can just have the and we have shared care in improving the quality of care. Yeah, so this is our vision actually. UKM for society. Our goal is we want to have this dashboard. Yeah, this dashboard review is not only for fetal growth. We can add on many more to incorporate more, so that the MyMOMS can be dynamically improved. Yeah, so that thing that we want to end before end is this is take home message. It's so simple. If we have this chart, we have this tape. Yeah, this tape, the paper tape, you can just easily get it. If you go to IKEA, you get this tape freely. Yeah, so only paper tape and generated customized growth chart needed. Yeah, for the mother to monitor their fundal height, and then if we have this shared implement in the primary care. Yeah, so our nurses we know that our nurses are the frontliner who are always doing the monitoring of the fundal height, so they can also be empowered through training, and also we can have early detection of HCA, and we can refer them early with confidence because we have evidence, the growth chart, to educate the mother and to show to the clinician that who they are referred to, that the mother and the clinician agreed that this fetal growth chart is on the declining, reaching the 10th centile. So they need to be seen by the clinician. A better ultrasound assessment need to be conducted to improve patient satisfaction through empowerment and quality of care. So that's all from me. Thank you so much. I pass back to Prof. Amelia.
Thank you so much, Professor Rosnah, for an excellent talk. So that was the presentation by Professor Rosnah about GrowMy, a personalized fetal growth, which is an exciting development, which is a digital platform which is incorporated into MyMOMS. And this is to enable us to reduce the prenatal morbidity and mortality, and even extended it into the ex utero life. You can see the graphs work beautifully, Prof. Rosnah, to see how it is personalized according to each woman and their own babies. First, before we go on to the question and answer and the panelist discussion, just a reminder to everyone, please do put in your questions, type your questions in the question box, not in the chat box, because in the chat box sometimes we have a lot of communication between the panelists to each other and to the IT people, and we may miss your questions. So please do put in your questions in the question box, and we will answer them later. Before we go on to the question and answer session, please do look at this slide to how to download our presentation slides and to fill in the survey. So this will enable you to win a 50 ringgit Starbucks gift card. Yeah. So what you have to do is fill in our short Google form towards the end of the webinar. We will provide this to you. Yeah. We will provide a QR code to the Google form and the URL link to the Google form in the chat box. Ensure your particulars are correct in order for us to email you the slides. And inshallah, we will also email you the certificate of attendance. Yeah, in order to be in the running for the Starbucks gift card, only fully completed forms, including optional sections with a valid work email, will be considered to win. Okay, so there are 20 Starbucks vouchers to be given out randomly, and each costs 50 ringgit. Okay, now we will go on to the panel discussion and question and answer. Prof. Zaleha and Professor Rosnah. Would you like to on your slides, your videos, please? Thank you, Professor Rosnah. Professor Zaleha? Okay. First, before we go on to the question and answer, so Professor Zaleha was good enough to type in some of the answers to the questions. we will read out, if we can, the answers so that all the participants can benefit from it. First, can I just ask Prof. Zaleha to share a little bit about your experience using the MyMOMS app?
Okay, thank you, Amelia. I think both Amelia and myself actually have been using it in our clinic. So Prof. Amelia also knows, the details about how the system is used. What happens is that first the mother signs up, okay, and puts in her details and all that, and then we will then sort of respond on our side once she reach a certain stage in the signing up as a patient in the system, and from then on it will be both of us have got an interface each to the system. That means the mother can see what is being entered into the system through her handphone, her smartphone, and we can also see if the mother enters something from her smartphone. So it makes for good communication in that sense. As I've shown just now, things like if the mother has got a question to ask, she can actually put it in. That facility is already there. And also her fetal kick chart, for example, if she enters it into the system, we can actually see from our end. Same thing goes for the home blood glucose monitoring. So every time she enters her home blood glucose monitoring, we can actually check on it on our side. So it makes way for good bilateral monitoring of the pregnancy.
Thank you, Prof. Zah. I think because we'll just extend by an extra 5 minutes the end of the session, if that's okay with everybody, so that we'll able to answer all the questions. I have used the MyMOMS apps on a few patients, as Prof. Zah says, and my patients actually like it, Prof. Zah. I think they find it's something new. They can look at it in the handphone, So the first time I tried it out, of course, because I've not used the system. It's the first time I tried it out. It was took a bit of time to figure it out, but actually it's very user friendly, And then after a while, you get used to it, and it's pretty fast, inshallah. So hopefully it can, it can replace completely the pink book. You don't have to fill in the pink book anymore, and the patients don't have to lug the pink book everywhere. And then if you look at the pink book now, it's all plastered, isn't it? All the investigations, all the you run out of pages and you plaster some more pages, So hopefully we can get away. No need to do that anymore with the implementation of this MyMOMS project. Okay, what about you, Professor Rosnah? Have you, Prof. Rosnah, belum try lagi the MyMOMS lagi kan?
Not yet.
Not yet, okay. And then, but it was very exciting to see how you developed the MyGrow the Grow My project. Okay, we'll go on to the question and answer from the audience. We'll start with the first one here. Okay, is the Grow My chart free to be downloaded and used for the whole Malaysia clinics and hospital? Prof. Rosnah?
Okay, as I mentioned, the product of Grow My is based on the research that we recently completed. Yeah. So the research is a collaboration with Parental Institute. The Grow My is developed by Parental Institute, but using our local data. So one thing that we want to inform that we are working with the MyMOMS platform to incorporate with this Grow My, so that those who are registered for the MyMOMS, they will get this Grow My in their platform once this MyMOM already incorporate. But the problem is we need to test, we need to test the system, whether is it have any problem or not before we can open up to everyone. Yeah. So we already tested using the Grow My in HUKM. Yeah, with the help from the clinician, they help in terms of put in their ultrasound finding and my student also put in the superformaldehyde in the system so that we can see just now in the slide. Later, we need to interpret it whether this can be assessed by the mother, because we did not ask the mother to measure and put in the chart yet. But through the virtual clinic and training that we need to empower the mother, because the current training that we have is to empower the clinician. It's not the mother yet. So we need to come up with add-on value in the MyMOMS, how to empower the mother from where to locate the formaldehyde and where to locate the symphysis pubis and how to make sure that the tape is stretched along that line, rather than senget-senget, So we need to clearly and see whether the inter-observer is also the same thing. Yeah. So we need to test the mother. How do they measure? If they're happy, then only we can generalize. Yeah. So once the MyMOMS been registered by many people, the information is there, and then everybody can just use it and update as long as they're registered with MyMOM.
Yeah, if I
Prof.
may just
Rosnah.
quickly,
Sure.
if I quickly follow up on Prof. Rosnah's answer to that. Yeah, somebody asked about superformaldehyde measurement done by the mother as well. Actually, our primary intention was actually for the clinician to do that and chart it on the Grow My charts. But then with the pandemic going on like this, we know that it is, both difficult sometimes and also risky for mothers to keep exposing them to come to the crowd at the antenatal clinic. And also for us actually to expose ourselves to patients who may possibly be carrying, COVID-19 and all that. So this is something that we are thinking of putting in as a telehealth component. And I think there's a question here about reducing the number of antenatal follow-up to clinic. Yes, we are thinking of achieving that. There's a recent paper in Lancet actually that says that patients can be reliably taught how to do their own formaldehyde. So that is what we are capitalizing on in order to do that, the telehealth thing. Thank you.
Yeah, thank you very much, Prof. Zah and Prof. Rosnah. So I think Ina Al-Amin asked here, is it convenient for the mother to use that measurement? I think Prof. Zah just answered, kan, the SFH2. And then another one, in some of the is some of the ethnic groups from Sabah Sarawak also included in the growth chart?
Yeah,
Prof. Rosnah.
Yeah, I think we are using HCTM data. Yeah, we did not have other ethnic group. The amount of other ethnic group recorded in our database is not that huge for us to come up with the TOW, the term optimal weight. So the systems only that we had captured is only for the Malay, Chinese, Indian, and Kadazan. The rest we put under others, because we have good numbers for Kadazan who delivered in our hospital, but not other ethnic like Iban or that. So but in future, actually, this Grow My actually is a lively, it's a dynamic. It can when we have more data through the MyMOM registration, we can just simply adjust the calculation, because we based on the 4 parameter that I mentioned to you just now. So we based on the data that we have, we can come up with the creating of the customized growth chart for the other ethnic group also.
Okay.
So the most important thing, we need to have the data in our bank, then only we can come up with a good customized according to other ethnic group. So currently we only use whatever data that we have in our hand.
I think the emphasis here is, as Professor Rosnah says, it's a dynamic situation, and then we are just started developing this and implementing it, and of course it will grow and develop as we go along. It will become bigger and better and more improved, inshallah. But at least it's a very important first step. Professor, just quickly, I thought just for the benefit of the audience, one of the participants asked, I can't find the apps in Apple Store, so where exactly can he download it? So Prof. Zah answered, this apps does not have to be down. Oh, sorry, Prof. Zah, go ahead. You want to answer?
Sorry, I think I have already answered somebody just now and put there
Yeah.
the link to use or sign up for MyMOMS. Yeah, okay. HTTPS mymoms.cc. Okay,
Yes.
or you can go to Masiniaga website. Actually, there is a QR code there that you can scan, and it will bring you to the apps as well.
Okay. So Prof. Zal has kindly typed this out in the question and answer box, the HTTP and the URL link, right, Prof. Zal? So if they want to access it, they just click at that box. Okay, I think we may have to end up here. Wrap up here. It's already 4:07. Thank you very much, Professor Zaleha and Professor Rosnah, for your wonderful lectures. And we have to thank Masiniaga also for their hard work in organizing this webinar, and also in the hard work in terms of the technological expertise in coming up with this MyMOMS apps. Before we end, we'd like to show you one more round of the videos, just in case you've missed it just now. And please do sign up. I do hope all of you will start using MyMOMS app soon and find it beneficial for you and your patients. Take care and stay safe. Thank you very much.
Hi, I'm Dr. Nadia. As an ONG specialist, I want the best experience for my patients. Monitoring their pregnancy growth is very important. Introducing MyMOMS, a digital pink book for expecting mothers. With MyMOMS, it is easy for me to monitor and personalize the growth charts of my patients. Here's how it works. When you have a new patient, get them to create a profile on MyMOMS. And then you can key in the details of their medical screening. Most patients have many questions in the first trimester, especially first-time mothers. With the Q&A function, your patients can ask questions and get answers from yourself or your colleagues anytime, anywhere. The first ultrasound is the most exciting moment for mothers. Once the scanning is done, you can upload the image into the app and you can access it for the next review session. Another exciting feature on MyMOMS is recording the kick counts. Patients can easily click on a button every time there is a kick, and the kick counts can be monitored by the ONG specialist. All personalized records are stored on cloud. Hello! So when preparing for a delivery, you can easily access your patient's records for a final review. MyMOMS creates a pleasant experience for you and your patients. It also makes it easy for team collaboration. MyMOMS. Baby steps on your palm.
Okay, now we will show the Google, the QR code, and then how to download the Google form. Please do fill in the survey, and you will stand a chance to win the Starbucks vouchers. Okay, so with that, I will end this webinar now. And I thank all the presenters as well as Masiniaga and the organizers for this webinar. And I thank all of you for participating. And I hope you find it very beneficial. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon. Thank you and stay safe.